Hi, my name is Tomoko Jensen-Otsu. I'm a veterinarian and evolution veterinary specialist. My primary jobs here are as an ER doctor on early triages. I also do dentistry. So there are some normal reasons for your dogs to cough. Sometimes when they drink water, sometimes they'll cough. Sometimes, they get something caught in their throat, they can cough that out. That can be pretty normal. When we start to worry about coughing is if it's happening very frequently, like every 15 minutes or so, that would be abnormal. If they're having more effort, so if they're coughing a lot and they're having to use like abdominal contractions, they're really pushing with their chest, that can be abnormal. If you're noticing they're having exercise intolerance, their color is changing to either a pale or a blue color, that would be a problem. If you're noticing any things like their abdomen is getting swollen, things like that, at that point, I think it is worth seeing a veterinarian. The other thing to watch for is some dogs, when they're coughing, can also have other symptoms. So vomiting, diarrhea, not eating, lethargy, those can all be reasons that may indicate there's an underlying issue, and coughing is kind of what you're noticing first. So in those cases, I do think it's worth reaching out to your veterinarian and having a discussion about when to be seen and what needs to be done. The time that I get concerned is when their energy level's changing, their appetite's changing, if they're getting really lethargic, if they're having discharge from their nose, if they're having a productive cough, those kind of things is when I get more concerned that there's things. Most of the time when owners are coming in with those kind of dogs, they're coming in because they're coughing, but they're also not eating. They're coughing and they are lethargic, they won't go for a walk, or they can't make it on a walk. A dog that has kennel cough that's 2 years old, that's bouncing off the wall and eating and drinking, is not as concerning as even the same 2-year-old dog that might have kennel cough that then turned into pneumonia, that then is lethargic and not eating, has a temperature of 105, right? Like, that's both kennel cough, but they present very differently. The amount of worry is a lot different for each of those cases. When I worked in general practice, where people would call and say, hey, this is what my dog is doing, do I need an appointment, right? And sometimes you're like, no, it's totally fine. And then lots of times you're like, no, that sounds abnormal. I feel like at least start with an exam. And then if the exam shows that everything's normal and the temperature and pulse and respiration are all normal, then you might say, okay, let's monitor. But if it's abnormal, then at that point you say, okay, there's some diagnostics we need to do, and then go from there. If you have any questions about your pet's health, please don't hesitate to get in touch with us.